I grew up in the Mackay area. My parents had a sugar farm, so my basic background is from the farm. I went to the local country schools for primary school. Secondary school, I went to boarding school in Charters Towers. After that, I was a little too young to start nursing, so I worked as an optical assistant for a few years before I started nursing at 17. It was always something I wanted to do since I was about 3 or 4 years old. It had always been my ambition growing up to be a nurse. Not any of the family were qualified nurses, so it just came out of the blue a little, yeah. I did my nursing training at the Mackay Base Hospital, and at that stage that was a 4 years training. After that I did a year midwifery in Tasmania, and then another year theatre operation and management in Perth. I had joined the CMF, as it was then, in Mackay after I came home from doing my midwifery. I think mainly the motivation there was my mentor, tutor sister, who was in fact in the CMF. So there's not a lot happening in Mackay, so I was quite happy to join the CMF with her. Again, there had been no army service in my family at all, so that was another sort of direction out of the blue. When I went to Perth for my theatre training, I transferred to the nursing unit in Perth, and it was at this time that Vietnam sort of started to bubble, and I joined the regular army from there with basically that intention. I was posted to SAS for 6 months or so in the RAP there, and then came across to 2 Mil and worked there for a couple of years before my posting to Vietnam came up. That stage at 2 Mil, we were receiving the guys back from Vietnam. So, and most of those boys, after they came back after they were medevaced from Vietnam, needed some sort of secondary surgery. So we were at least a day or two sort of redoing their redressing their wounds and settling back into Australia before they went home. Yeah. So I had some awareness of the type of injuries that was happening in Vietnam. But honestly, I don't think anything really prepares you for that. It's just so different to any road trauma or anything else that you might see in civilian street, yeah. I went as a replacement. In fact, the lass that I replaced was a friend of mine from Western Australia. She also was a trained theatre nurse, but unfortunately she developed hepatitis and had to be evacuated, so I was her replacement. And that was about, December 1969. I personally was very happy about it, really. I did want to go. I have to say that my mother was dead against it, and that caused a fair amount of distress in the family at the time. But, I was in the army, in the regular army, and I was determined to go because of my theatre training sector, sort of knowing that, I could probably do something worthwhile and interesting that I felt I wanted to do. I was quite impressed by the place. Some of the operating theatre technicians who were in the theatre when I arrived at One Ostfield Hospital, I had worked with at 2 Mill. So as far as, and of course I had worked with Michael at 2 Mill as well. So, and it wasn't completely strange, personally, socially, or whatever. I was quite impressed with the little operating theatre setup that we had at One Ostfield Hospital, but there were lots of little improvements that needed to be made and that were made. And in fact, at the time that I arrived, they were doing, the carpenters were doing some minor modifications to the operating theatre as far as change rooms and scrub-up areas and things like that was concerned. And that was, in a sense, keeping a lot of people who should not have been wandering through a sterile area anxious to know what was going on inside, but had no business to be there. So it was creating some sort of isolated and sterile environment, which is exactly what we had to have, of course, for an operating theatre. And at the same time, they were also building an intensive care ward on the side of the theatre, which prior to that the seriously ill patients were nursed in one of the main wards as well. So I more or less walked into a separate intensive care unit, a separate isolated theatre group, and quite apart from the surgical and medical wards. It was muddy, and of course, it's understandable that people were anxious to know what was going on inside, and the unfortunate thing was that at that stage they were allowed to come inside with their dirty, muddy boots and all that sort of thing. So we would have even mud coming into the foyer of the operating theatre, which was really horrifying. I worked 8 to 5 and as necessary, and as necessary means 24 hours a day, basically. We had 2 operating rooms. One room had 2 operating tables in it, so that we could have 3 operations going at the same time. Basically, we had 2 surgeons, 2 anaesthetists, and then a couple of junior army doctors or doctors with other specialties who could take up the 3rd theatre role. So some days we would have nothing on and we were just doing preparation for the next day or the next day or the next day. So, there's all the sterile instrument trays, the sterile linen bundles, the drug trays to set out and have ready for the anaesthetists and for the resuscitation. There is a lot of work to do behind the scenes to make a triage and operating theatre function as it had to. Mostly in the actual operating team itself, as far as the nursing side of it was concerned, I had about 12 theatre techs on rotation of different ranks, sergeants, 2 corporals, and the rest as private soldiers. Some were National Service boys. 2 of the boys, I remember, were their number came up when they were doing medicine, so they were med students. that doesn't mean much, except that they maybe knew a bit of physiology or whatever, but they wouldn't have known anything about hospital functioning at that stage. So we basically had to teach the boys what to do. That is, I'm talking about just the theatre part of it, rather than they'd already done their basic training and their core training. There was a job description in the military that was an operating theatre tech, OTT. They had numbers for classifications for these jobs. There was a medic classification. The theatre tech classification was an ECN something 5, I think it was. And there was more or less a prescribed course that we put the soldiers through at 1 mil and 2 mil in their training for them to become theatre techs and be able to work in the theatre. So we had the regular soldiers in that category, plus the other National Service boys, and then some medics that were interested in that sort of work that we actually trained on the spot at the hospital. So basically, as far as the operation of the staffing of the operating rooms itself, we would have the surgeon and an assistant. We would have what we called a scrub nurse or an instrument nurse, who was sterile, handed the instruments up to the surgeon, and then I would allow the technicians to do those sort of roles, which allowed me to be able to be the scout or the circulating person, so I could be available to more or less keep an eye on all 3 areas at the same time and respond to triage if anything came in on the helicopters. That's just the sort of day-to-day activity. It became quite a different scene, of course, when we had dust-offs. Triage, you would hear that word's used quite a lot now. Here, at that stage, it was sort of a French word meaning sorting or, allocation of priorities. We had a big triage hall with 3 stretchers, 3 trolleys on either side, and that would come straight from the passage to the dust-off, where the casualties were carried in. And on those 6 bays would be the main resuscitation areas. And that area would become quite crowded, really, with your surgeon and your anaesthetists looking after the most serious patient, and then a patient who perhaps just had a minor laceration would be put on bay 6, and they would be allocated sort of 1 to 6 in that sort of need of care. But, in that little area we would have the X-ray happening, pathology happening, taking blood and blood tests, the Q-store happening, taking the soldier's weapon and clothing and possessions, personal possessions that he may have had on him. We'd have the admin people doing the paperwork and helping us record the vital signs and whatever on a whiteboard near the things, so we were all aware of what treatment the patient was being given. The theatre techs would be there helping with the resuscitation until they were needed inside in the operating rooms. We even had, when I say we had the padres in as well. sort of allow the padres to get closer to be able to talk to the patients, or particularly the very ill ones. I remember teaching a couple of them how to hold the oxygen and oxygenate the patient so that they could also perform a medical resuscitation role as well as talk to the patient and about his spiritual needs or whatever at the time. With the dust off, we would all be needed in triage for the resuscitation and reception and resuscitation of casualties. And as the casualties were resuscitated and the doctors decided what surgery needed to be done, that patient would then one of the operating theatre team would go in and set the theatre up and get things ready, and that patient would go in and the surgical team would follow. So basically our role was reception, resuscitation and operation, and then preparation for it all over again. I could divide the soldiers in two categories, the ones I worked with and the ones I worked on, basically. The ones I worked with were they were basically my best friends in Vietnam. They were the people that I relied on because we did such a lot of training. On a normal day where we'd finish work at 5 o'clock in the afternoon, we'd have dinner and the guys had come back to the area where we'd talk to them about operative procedures and teach them various things. The surgeons and were very helpful in that regard too, and often gave lectures to the boys down there in the area just to upgrade their training and make them more confident at what they were doing. As far as the patients were concerned, we didn't. Once a patient is anaesthetised, of course, once the operation starts, you lose contact with the patient because he's anaesthetised. Yes, I felt very much for them in triage. Most of those kids had probably never been near a hospital before, certainly not in hospital, and suddenly they're thrown into this area where everybody is saying, no, just put your arm out here, I'm just putting a blood pressure cuff round here, just a pinprick and, in your hand for the drip to be set up. And, there was just so much happening all at once that I often wonder really what they must have been thinking at that very moment, because you would expect, I guess, and what you see particularly on television with MASH and things like that, there's so much noise and stuff going on at that time. But our place was always strangely silent. Everybody got about their business without making too much noise about it, and you could only hear them sort of quietly asking for this or asking for that, or asking, have you got any pain now? There was really very little noise in that area that was just so extremely busy and with so many different types of people in it. I showed the padres what to do. So someone could be there actually touching the patient and talking to the patient. And by that, I mean talking at his head so he could see what was doing, and they were quietly talking to each other. When the padre wasn't doing that, that was my role in between. So yes, that importance of touch and talkingly, quietly and directly to that boy, not, you're not talking to the rest of the group. You're just communicating with that soldier who has been injured, yeah. It is very important. My role was pretty isolated if compared to the rest of the nurses. I was the only nurse in the theatre area most of the time. In busy periods, other girls came in. One would come in to help out, but basically I was the only nurse in theatre most of the time, which meant my hours on duty was in a different place, didn't coincide with the rest of the nursing team. Often my hours off duty didn't coincide with the rest of the team either, because I'd be called back or something like that would happen. So in many ways I didn't have lots and lots to do with the other nurses. The patient would leave me anaesthetised or just waking up from anaesthetic and go back to the ward. And I wouldn't see them again unless I particularly called into the ward on my way to see how they were doing. But my nursing role for that soldier was basically finished at that stage. In the evenings, as I said, I would often come back to the operating area to train the theatre techs. And my memory has it that was the way that I spent most of my time in the evenings. I didn't spend a lot of time in the mess. I can remember one occasion we were having a bit of a party and I'd probably had one or two wines, and of course as always happens, the siren goes and you're called back. And, I made a decision that I wouldn't party anymore while I was in Vietnam. That didn't worry me one little bit, but, I was conscious that I had to be alert at most of the time. There was a few of the nurses that I knew very well that were my close friends, and probably they're the ones, but there's not a lot of time left by the time you finish all those things, get yourself organised, write your letters home, and those sorts of things. It's actually, really writing letters home is quite a demanding thing in that sort of situation, because you can never really write the things that you've been doing and the things that you feel and whatever. It's all a bit of a make-up. I think most of us sort of became fairly avid readers. I can't remember what craft I was doing, but I surely would have had something, because it's one of my main things that I do now. But it was pretty easy to just while away the time, really. I think the very busiest period, although early 1970, February 1970, and then most of 1970 was very, very busy. It tended to quieten down towards the end of 1970, towards the end of my time there. But basically it was just work and socialise within the theatre group itself, within the, as I said to you, the theatre technicians more or less became my best friends in that situation, because they were the ones that I not only worked with from day by day, but also spent time with in the evening, trying to talk them, and I guess in many ways counselling them. We did never break up from a dust off without all collecting together, and the boys would have their beer. They kept a bottle of scotch up in the ceiling for me, but we would always collect together and talk about the day's proceedings and what we had done, and what was wrong with each patient and how they might recover and all that sort of thing. So there was all this sort of post-operative counselling, if you like, although it was more just talking about it, discussing it. Counsel is probably a term thrown in to understand more how the direction of the conversations would go. Michael was a CO at 2 Mil when I came to 2 Mil from the West, and I didn't know. I had never been to Sydney before. As I said to you earlier, I was very much a country girl. The people from Perth had organised my flight, etc., across to Sydney. The plane landed in Sydney. I got off, went to the Ansett or TIA lounge, and I couldn't find anybody in uniform, which I was told would be there, whatever my driver. Anyway, after a little while, I phoned the matron at 2 Mil, and again, bearing in that time, we didn't have mobile phones. We had to go through the public phone box system. And anyway, she eventually, I think it might have been Michael on this end, as CO said to a matron, "What's wrong? Shouldn't that sister be here by now?" And they found out that I was still at the airport waiting for someone to come and pick me up. Anyway, the driver eventually picked me up. We got out to 2 Mil, and the matron was I was in the matron's office, talking to her as initial interview, and Michael, as the CO, came in and "Oh, you finally arrived. Oh, good." And he had this sort of cheeky grin on his face, which almost made me angry. Anyway, that was the very first meeting, I suppose. And I mean, after that, I was just working in the theatre at 2 Mil for the next couple of years before my posting to Vietnam came up. And of course, in the meantime, Michael had been posted to Vietnam again, One Osfield Hospital, but we didn't really know each other in that time at all. I mean, he was the boss, and I was the theatre nurse, and other than polite conversation at mess functions and when he did his hospital rounds and things like that, there was no communication. I think they're an excellent record, I really do. Some of the photos they were photos of people who were actually working there. Even to one of my corporals with his bucket and mop, mopping the floor, or should I say leaning on the mop, but anyway, and of some of the boys from the Q store actually pushing a trolley full of clean linen, of some of the boys from transport with the hood of the Jeep up and doing things in the engine, and patients being checked into admin at A&D, or checked in or out, and You know, the photos that he actually took of the hospital were of people doing their job at the hospital. You know, the X-ray technician taking his X-rays, the pathology people doing things, the doctors looking at an X-ray up on a screen, and you can almost see them thinking, now what's going on there? You know, it's those sort of professional type photos that Dennis took that have been very, very valuable, I feel. They would... Sean must have given permission, Dennis first, I suppose, Sean later, given permission for his photos to be used quite often, but I know of several books now, and also an opera that Dennis's photographs were actually used as backdrops or as illustrations in these post-Vietnam records. So, yes, I think his photos were excellent, and they really have proved a great record of what the hospital, if we're narrowing it down just to us, what the hospital did in Vietnam. We have a fairly established Field Hospital Association, which has kept a lot of us together, and I must say that the association was initially put together by one of the theatre techs, and I think it was probably his way of sorting out where he fitted in things, coping with perhaps his stress after Vietnam, and keeping people in touch and involved with the same group that he had been working with over there. But I've been the Queensland rep for that organisation now for about 4 years or so, and every couple of years, of course, we have a reunion and a bit of a get-together and things. Anzac Day is very important, and as the Queensland rep here, I always organise the little get-together after the parade for our field hospital group.